Hey, good evening, and welcome to the college's second webinar on our new CIRCL program, where we'll be going over the standards and requirements for pharmacies. Before we begin, we just have a couple of reminders. If you're experiencing any technical issues, please email communications@bcpharmacists.org. We also wanted to let you know that the presentation portion of this webinar is being recorded and will be shared and posted on our website after this session. Our first introductory webinar is available online, and future CIRCL webinars will also be posted. So if you haven't attended live, we encourage everyone to watch these, preferably in order where possible. And lastly, if you would like to submit a question, please click on the Q&A button at the top right-hand corner of your screen. And for those joining from a mobile device, it might be on the bottom of your screen, and this is separate from the chat button. Q&As will be answered at the end of the webinar, but we encourage you to enter questions as we go along, and we will try to sort and get to as many of them as we can. As we get started, I'd like to acknowledge the rights and title of the First Nations on whose collective unceded territories the Office of the College of Pharmacists of British Columbia, where I am presenting from today, is located. These are the homelands of the Hunkaminam-speaking peoples in the territories of the Musqueam and Tsleil-Waututh nations and the Squamish-Natrum-speaking peoples of the Squamish Nation. These nations have existed here for over 9,000 years, and we continue to support their inherent rights and title to these lands and waters. In recognition of our role in serving people and communities across the province, we also acknowledge the rights and title of over 200 First Nations whose collective unceded territories stretch to every inch of what is now colonially known as British Columbia. As leaders in the settler health system, we acknowledge our responsibilities to uphold the inherent and enduring rights of Indigenous peoples across Canada under international, national, and provincial law. So my name is Mark Chan, the Acting Director of Practice Reviews and Quality Assurance here at the College of Pharmacists of BC. I've been working on medication incident reporting over the last few years, and I'm really happy to be here today to talk more about the standards and requirements in detail, as I'm sure many of you are wondering how it's going to affect you. So for tonight, we'll start by briefly going over an introduction of CIRCL and the key implementation dates. For those of you who are watching a recording of this in the future, we encourage you to go back and watch webinar number 1, where we introduce CIRCL, the national databases, reporting, and shared learning in more detail. Next, we'll go over how to get started and more details about reporting, followed by some activities and practical tips as part of collaborating, and then finish things off by talking about learning and how this feeds into continuous quality improvement. For those attending live tonight, we'll save some time at the end for questions and answers. As you've probably seen by now, CIRCL is the college's comprehensive medication incident reporting program for all community and hospital pharmacies in BC. CIRCL is based on the NAPRA Model Standards of Practice, which ensures national consistency, while at the same time we conducted extensive engagement with our partners to ensure that the specifics of CIRCL are effective and practical for BC. And CIRCL is built around 4 elements that work together to improve medication safety in pharmacies. Continuous improvement means regularly reviewing how your pharmacy operates and making changes where needed. Reporting is documenting incidents and near misses in a consistent way so patterns can be identified. Collaborating brings teams, clients, and other healthcare providers together to share information and address safety issues. And learning is where we use what we find from incidents to make changes that reduce risk in the future. These elements work together to enhance quality and medication safety, helping pharmacy teams prevent harm before it happens. As a brief overview of how CIRCL works at a high level, incident and near miss data collected by pharmacy professionals will be entered in a reporting platform at the pharmacy level and then submitted in de-identified form to national databases. These databases enable the secure collection and analysis of medication incidents while protecting the identities of those involved. The de-identified data submitted to these national databases will be combined with data from pharmacies across the country. This aggregated information will be used to identify national trends, facilitate shared learning, and inform the development of medication safety recommendations, which pharmacies can then use for continuous improvement to make changes to their processes. The bylaws that establish CIRCL and its standards have been approved, and the transition period is currently underway. So full implementation is required by June 1st, 2026, and that's the date when all requirements will come into effect for every pharmacy. And when we do our pharmacy inspections, that's also when we'll start ensuring that pharmacies are meeting the CIRCL requirements. So from this visual of the most important dates, you can see here that we're currently in a transition period. We know it does take pharmacies time to get systems in place, develop policies and procedures, and train staff. So we encourage everyone to use this time and start early because by June 1st, 2026, the bylaws will be in effect and all pharmacies must have the reporting platforms in place, start reporting, and must meet all requirements. For the first team meeting and first safety self-assessment, which we'll talk about later, they must be completed within 1 year of the bylaws coming into effect, which means they must be done by June 1st, 2027, and then at regular intervals going forward. So now we'll go into how to get started and what this means for you. So as we've said before, CIRCL applies equally to both community and hospital practice. In terms of what's currently happening today, both practices have always had existing quality management requirements that include a process for reporting, documenting, and following up on known, alleged, and suspected errors, incidents, and discrepancies. The main difference is that hospital practice and health authorities have already been using a reporting platform called the BC Patient Safety and Learning System, or PSLS for short, and they've been using this for many years now. Whereas in community practice, some pharmacies may be using platforms already, but it may not be submitting to the national database, while other pharmacies may still be documenting on electronic forms or paper or other means. And in both cases, pharmacy professionals will need to ensure all CIRCL processes and requirements are met, which will take some work because it goes beyond just having a compliant platform. So, for example, needing to develop policies and procedures, handling of near misses, holding team meetings, and completing safety self-assessments. However, in terms of talking about just the reporting platform itself, we can confirm that the BCPSLS platform that is currently being used within hospitals does meet our requirement. That is, of course, assuming that they continue making sure everyone has access to it and is properly trained on it. For community pharmacy, however, several steps will be needed. So first, pharmacies will need to either select a reporting platform that meets the CIRCL requirements or confirm whether their existing reporting platform, if it's being used, is okay. The next step will be signing a data sharing agreement between the pharmacy and the National Incident Data Repository, or NIDR for short, which is housed by ISMP Canada. This form is available online and enables de-identified data to be submitted from the reporting platform to the national database via a secure transfer protocol. And finally, once this is all set up, managers need to ensure that pharmacists and pharmacy technicians have access and are trained on how to use this platform. For the platform, pharmacies can choose and use any reporting platform that's suitable for them, as long as it meets the college's criteria. So the first is de-identified data. The platform must have processes in place to ensure there are no client, pharmacy staff, or pharmacy identifiers in the data submitted to the national database. For example, no individual names, PHNs, registrant ID numbers, etc. And second, submission to national databases. The platform must be able to share de-identified medication incident and near-miss reports with the appropriate national database. And again, in webinar number 1, we do talk more about the NIDR and NSIR databases. Lastly, mandatory data fields. At minimum, the platform must enable and require pharmacy staff to enter information for 8 mandatory data fields, which we'll go over next. So these 8 mandatory data fields are the date the incident occurred, the type of medication incident. So for example, was it the wrong drug, strength, client, etc.? Who discovered the incident? So this is the position or job title only. For example, was it the pharmacist, the technician, client, caregiver, or someone else who discovered the incident? Also, medication system stages involved. For example, did the incident occur at the prescribing stage or at order entry? Was it during the prep or dispensing process? Or maybe something was missed during the monitoring or follow-up steps? Another field is the medications involved. So this involves entering the DIN or NPN of the drug. Also, degree of harm to the client. And this can range from a near miss, no harm, all the way to severe harm or even death. Also, there's an incident description or how it was discovered. And lastly, contributing factors, which I'll go over in the next slide. And for these 8 mandatory data fields, this might seem like a lot on the screen here, but we'd like to point out that the national database has specific allowable responses for the content to ensure the data is submitted consistently across Canada. And what this means is that other than the incident description field, which requires you to enter free-form text, most platforms may have easy drop-down menus or selections that you can simply pick from. And as an example of a data field, one important one we wanted to highlight is contributing factors. So what are contributing factors? These are any circumstance, action, or influence that played a part in the incident or could increase the risk of similar incidents occurring. Contributing factors shift focus from blame to improvement. So instead of asking who made the mistake, we try to ask what in our system led to this happening. Examples of contributing factors include critical client information missing. For example, was it missing allergy information, weight, medical conditions? Miscommunication, for example, a hard to read or confusing prescription, misheard or misunderstood order. Drug name, labeling or packaging problem, There could be environmental, staffing, or workflow factors. For example, was there noise, clutter, interruptions, or some issue with the workflow? Perhaps there are staff or client education issues. For example, was there a gap with the training and orientation process? Perhaps there was wrong or missing information given during the client consultation. And these are just some examples, and there are many more contributing factors. But like I mentioned earlier, most platforms will have options you can pick from to make data entry as efficient as possible. And ultimately, this is one of the most important fields because while all the other information is great and really useful, this field is where a lot of the learning comes from. We've listed some examples of commercially available reporting platforms here. The BC PSLS, as mentioned, is already being used in health authorities and hospitals. For the community, known platform providers include the Community Pharmacy Incident Reporting Platform, or CIFR, Pharmapod, or the Patient Safety Company Cloud. And please note that this isn't an exhaustive list, and other platforms may be used if it meets the criteria we talked about earlier. And the college does not approve or endorse specific platforms, so it will be up to the pharmacy to choose the platform that best meets their needs. So after the platform has been selected, data sharing agreement signed, and everything set up, here are some practical tips to help you get started. So you should complete any training provided by your platform provider and manager or employer. And this might include demos or tutorials, or perhaps more pharmacy customized content as well. Learn how to use your platform to actually document those incidents and near misses. Understand how to complete mandatory fields because it helps being familiar with what needs to be entered beforehand. And make sure you can access and use the platform because nothing's worse than trying to report something on the spot only to discover that you don't know the password to log into the system. So next, we'll talk more about reporting. And this might be obvious to most of you, but we have to mention it. The most important step is to take immediate action when an incident occurs or is discovered. In terms of attending to the affected clients, this might mean ensuring they receive the correct medication or correct instructions right away, assessing if medical attention is needed, and providing appropriate care immediately. And you may need to contact the client's prescriber or other people in their circle of care. You should also take immediate action if others might be affected. And of course, the pharmacy manager should be made aware of the incident as soon as possible. And for example, I remember when one of my clients brought back a vial that had a random tablet mixed into it, and it wasn't something that was on their profile. The problem was this came out of our Script Pro automated dispensing machine, where if the wrong drug got mixed into the cell, many clients could have been affected. So obviously, I stopped everything I was doing, pulled the cell out, checked it, pulled all the logs to see when it was last replenished, and ended up calling some clients to make sure they check or bring back their bottles. And thankfully, no one else had any issues, but this really just highlights what we mean when we say sometimes you have to take immediate action. And assuming that the most immediate actions have already been taken, this slide just goes over the various aspects of how to handle a medication incident. So you would, of course, disclose the incident to the client or client's agent if they didn't already know about it. This might include a meaningful apology and clearly explaining what happened in language the client can understand and describing any health consequences. And then following up with the client or client's agent to monitor for effects of the incident, if applicable. You would also share information with other health professionals in the client's circle of care where appropriate. You would document the incident and follow-up plan, and then submit a report to the national database using the Pharmacies reporting platform. Finally, when appropriate to do so, you would communicate improvements with the client or agent and share how learnings will be used to prevent recurrence. And we know this seems like a lot of steps, but none of these things should be new concepts to anyone. When an incident occurs, these are probably things that most people already do intuitively, except now we're putting this in writing to offer guidance. The only new thing here should be submitting a report to a national database, which we'll go over next in more detail. In terms of who must report incidents or near misses, this is the responsibility of all pharmacy professionals. This will be the person who discovered or was involved in the incident or near miss, and includes both registered pharmacists and registered pharmacy technicians. For what to report, all medication incidents that reach a client must be reported and submitted to the national database. So regardless of whether harm occurred, if something has reached a client, it must be reported and submitted. You might also have near misses that don't reach the client, and these might also have to be reported and submitted, but it depends if it meets certain criteria, which we'll talk about. So to start off, what is a medication incident? It is any preventable event that may cause or lead to inappropriate medication use or client harm that has reached the client. Again, anything that reaches the client must always be reported. I've talked about some of these already, but examples of incidents can include wrong medication dispensed, wrong dose, strength, or quantity, medications dispensed to the wrong client, incorrect route of administration, omitted medication or dose, expired medication dispensed, labeling errors, and others. So we just talked about medication incidents, and those are things that have reached a client, must be reported. But we also encounter near misses, which are events that did not reach the client because it was caught by chance or in time, but could have resulted in unwanted consequences. So examples of near misses can include things like the client or staff noticing the wrong drug at the pickup counter, a wrong dose caught before it reaches the client. For example, mixing up milligrams and mils and giving 10 times the amount of methadone. An allergy alert that was on the profile but got missed and caught during the consultation. Look-alike or sound-alike drugs, for example, ampicillin and amoxicillin. And this is actually a real example that I personally still remember really clearly. When I was a new grad and typed the prescription for amoxicillin, it was all prepared and labeled. And as my manager was doing the final check, he looked at the prescription, which was handwritten, paused, turned to me and said, "Hey, I think this actually says ampicillin." I was mortified, and I don't think I'll ever forget that. I was so lucky though, because if it was me who walked back there and checked it, I probably wouldn't have caught it. And I think I've only seen ampicillin maybe like 2 other times in my career, but every time I see it, I remember. And by the way, as a side note, in my defense, it really doesn't help that both drugs come as 250 milligram and 500 milligram capsules. I'm just saying. Anyways, I'm sure all of you have also encountered near misses that have been forever etched into your brain, like it has for me. And the whole point of reporting them is to help other pharmacy professionals learn from them as well, so that they're also made aware and that they can prevent these near misses from happening in the first place, instead of personally going through it, relying on luck to hopefully catch it before it reaches the client. So when should you report near misses? Pharmacies must establish their own policies to define when near misses must be reported and make sure the staff understands these. A lot of times, these pharmacy-specific policies can vary and will depend on the context and type of practice. But at a minimum, in these policies, a near miss must be reported when any of these three criteria are met. Firstly, if the event had reached the client, actual harm would have been likely. Second, if the event is a recurring problem for the pharmacy. And lastly, if the event provides a learning opportunity for the pharmacy or for the pharmacy profession practice in general. So pharmacies should really make sure that their policies are clear, accessible, and easy to follow, with these three criteria as the minimum starting point. And I also just want to take the opportunity to address something that we get asked quite frequently, and that is, if you make a typo, are you expected to report it as a near miss every single time? And the answer is it depends. And you'll need to look at your pharmacy's near miss criteria and use your professional judgment to make the call. What I can say is that the intent of these bylaws is not to make you run around reporting typos all day that add no value. So if something was caught during an established process within your workflow, for example, during final check, which is designed to verify everything, you potentially don't need to report it. But at the same time, if it does provide a learning opportunity for others, like in my ampicillin example earlier, I would have reported that. And even simple typos, some might be minor and don't need to be reported. But if that same typo keeps happening over and over again, you should look into it and see if there's a reason behind it. So, for example, maybe you have a pre-programmed SIG shortcut that was entered wrong, or perhaps something else that others can learn from. So I've just talked a lot about near misses and needing to have written policies and criteria. But the pharmacy manager will also need to develop other written policies and procedures and make sure all staff are trained on these. This includes a continuous quality improvement program for the pharmacy. And the bylaws do go into much more detail about what this means and what specifically must be contained in these policies. A process for reporting, documenting, analyzing, following up on, and learning from medication incidents and near misses, of course. And clear steps that pharmacy staff must take when an incident or near miss occurs, including steps for disclosure, which I went over briefly earlier. But some pharmacies will probably have more specific steps, such as what to document locally, notifying the manager or other colleagues, using their specific reporting platform, etc. And these are just some highlights. And this is definitely something pharmacy managers should start developing between now and June 1st, 2026. As a practical tip, managers should ensure all pharmacy staff are consistently trained on CIRCL requirements, including providing training for new hires and updated training when policies or platforms are changed or improved. And as a reminder, every pharmacy professional has an obligation to familiarize themselves with their responsibilities under these policies. And this individual responsibility is outlined in the standards of practice and code of ethics. And this can include things like learning your own pharmacies, policies, and procedures, understanding what must be reported and when, knowing your own role in incident response and disclosure, and finally, incorporating continuous quality improvement into your practice. For how reporting drives continuous improvement, every incident or near miss you report becomes data that helps identify patterns and prevent future harm, not just in your pharmacy, but across BC and Canada. Your reports contribute to understanding what's wrong in your pharmacy systems, identifying recurring issues that need attention, developing targeted improvements, sharing learnings provincially and nationally, and building a culture where learning is valued over blame. Each time you document an incident or near miss with clear contributing factors, you create an opportunity for meaningful change that protects clients. So next, we'll talk about collaborating. CIRCL supports collaboration at many levels. Within your pharmacy, this means working together as a team to analyze incidents, identify contributing factors, and develop and monitor improvements. At a national level, your de-identified reports flow to national databases where they're combined with data from pharmacies across Canada, revealing patterns that inform national safety recommendations and bulletins. So all of this leads to collaboration that transforms individual incidents and near misses into collective learning that can be used by all. A key component of collaboration involves holding routine team meetings with pharmacy staff to review and assess incident data, discuss contributing factors, and determine how to address identified issues. The initial meeting must be held before June 1st, 2027, and then on an ongoing basis, at least every year thereafter. These meetings must be documented and must include all of the following: the date of the meeting, the names of pharmacy staff in attendance, topics of discussion, and any resulting improvement plans. During our engagement process, we have heard that most pharmacies already hold regular team meetings of some sort, whether that's to discuss operational or other topics in the pharmacy. And these existing meetings can meet our requirement as long as you include the discussion of incident data, medication safety, and how to address issues. And then, of course, documenting all of these with at least the 4 points that are listed here. In terms of what these team meetings might look like in practice, you should be proactively reviewing your own incident data and identifying any trends that might appear, reviewing available provincial, regional, and national level data, discussing contributing factors and determining how to address them, determining actions needed to prevent recurrence of incidents, and reviewing safety self-assessment results and improvement plans. Another new requirement within CIRCL is to complete a safety self-assessment, or SSA, which is a tool used by pharmacy staff to proactively identify potential safety risks and system vulnerabilities, which can help pharmacies find opportunities to improve safety. The initial SSA must be completed before June 1st, 2027, and then on an ongoing basis, at least every 3 years thereafter. The SSA is a specific software tool or platform that can generate a self-assessment for the pharmacy. They're intended for internal use and consist of many self-assessment items that are related to best practices in medication safety. And one SSA is completed for the entire pharmacy. So usually the manager and or staff would go through this tool. You would assess how often your pharmacy is meeting these identified items. They can then view your results and compare this with aggregate scores of other pharmacies and use this to guide your own improvement plans. The two tools you can use are the Medication Safety Self-Assessment, or MSSA, from ISMP Canada, or the Pharmacy Safety Self-Assessment, or PSSA, from Think Research. Potentially, you could use an equivalent software tool or platform appropriate for your pharmacy's license type. If a new tool becomes available that has the same features and capability as the MSSA and PSSA. However, we wanted to emphasize that internal checklists or corporate audits do not meet the SSA requirement in terms of capability and content. Although only one SSA needs to be completed for the pharmacy, ideally, all pharmacy professionals should be involved in the self-assessment process. And as you go through the SSA tool, it helps you examine all areas of your practice to help identify potential risks and vulnerabilities. And this is where everyone can also provide input on current processes. Team meetings would usually also be a good time to discuss the SSA findings. And as a matter of fact, some pharmacies use their team meetings to actually go through and complete the safety self-assessment together, sometimes even splitting it up and completing it in smaller chunks between multiple meetings if needed. And ultimately, you would use the safety self-assessment results to guide you in implementing any system improvements. So we've just talked about reporting, team meetings, and doing safety self-assessments as part of collaboration. And together, this allows you to identify system issues that individual analysis might miss. And also to develop improvement plans with input from those who actually work within those processes, thereby creating shared ownership of improvements. These activities will then build a culture where learning from incidents becomes routine practice. And when your team consistently works together to understand what went wrong and combines that with insights from provincial and national data, every incident becomes an opportunity for meaningful system improvement. Next, we'll talk about learning and putting everything together. Learning is really about putting insights into action, where you take individual incidents and turn those into opportunities for systemic improvement. This can come from your own pharmacy's incident data and trends. For example, you might notice more incidents occur during certain times of the day or more commonly with certain drugs. Also, your team's insights through analysis, team meetings, and safety self-assessments, and learning from provincial and national trends. At the end of the day, it's about taking your learnings and putting these into action and turning all of this into improved client safety. Some practical ways you can do this are, of course, participating in incident analysis and helping to identify things that could have played a part in those incidents, using learnings to develop and implement action plans with improvements that are specific and measurable, and then monitoring whether these improvements are working to prevent similar incidents. And this is something that we often forget to do, since we're quick to implement improvements and check the box and it feels great, but we don't always circle back to see whether those improvements are actually working. Or in some cases, maybe they're actually causing other unintended consequences. So that follow-up piece is important. Finally, staff should work with the pharmacy manager to review and update their policies based on the learnings and continue to adjust where needed. So tonight we have focused on reporting, collaborating, and learning. The goal of all of this is to promote continuous quality improvement so that reporting gives pharmacy professionals the insight and learning they need to make meaningful changes and reduce medication incidents. Instead of focusing on what's working, continuous improvement challenges us to consider where can we improve. Continuous improvement is about a structured process used within a pharmacy that allows for the ongoing review and enhancement of all aspects of care delivery to ensure quality and safety for all our clients. And that's what makes the CIRCL program. And to help you prepare during this transition period, we've developed resources that are now available on our website at bcpharmacist.org/circle. These include an overview of the program and key requirements, guidance on selecting a reporting platform, implementation steps, best practice guidance, and FAQs. We'll continue adding and updating resources throughout the transition period. We're actually currently in the process of developing a quick start checklist, which will be shared shortly. And all of these resources are there to support you and your team in putting the new standards into practice. So this is the second in a series of webinars to help you prepare for CIRCL. Our next session, webinar number 3, will be on March the 5th, 2026, and will focus specifically on the client perspective. Then in April or May, we're planning to hold our final webinar. And each webinar will build on the last, giving you more detail, practical guidance, and time to ask questions as we move closer to full implementation on June the 1st, 2026.